Hello everybody, this is Dr. Jean-Guy again. This week the question that we would like to answer is, why do most people when they come to our office, specifically, why would we want to take an x-ray of their spine or pictures of their spine? And the reason why we want to do this is quite important, and I want to take a little bit of time to explain to you to make sure that it makes sense. So if you were to go to the hospital and to have x-rays, the purpose of taking x-rays at the hospital would be to look for infection, pathology, or something that might be broken. And when a patient comes into our office, certainly if they have a history of trauma, we want to be taking x-rays of their spine, but also something that is totally different than any other places is we specialize into spinal correction. And unless we can see the spine structurally, we don't know. If we know what in place is, then we can determine if things are out of place and how we can correct them. And in order to be able to do that, there's a couple of things that we do in the office. Number one is we're going to take pictures of your posture. And when a person has postural distortion, that tells us that they might have had some prior injuries to their spine that have been left uncorrected or not fully corrected. And then also we're going to go on the inside and we're going to be able to see where the person is at in terms of structure, and that would be impossible to do just with the eyes because it doesn't matter how good you are, you would not be able to determine the sagittal curvature of the spine, which sagittal means from the side. When you look at a person from the side in their spine, in the spine itself, you need to see some specific things, meaning having spinal curvature. It looks like a banana, it's like a C-shaped curve, and there's no way that you would be able to tell that unless you would be taking a picture of the spine. And there's also in some cases where if there's instability in the spine because of ligamentous damage, and again, there's no way that you could tell that, otherwise there's things that you would not want to do with the spine in terms of adjustment. So when people say, well, Dr. Jean-Guy, why can't you just throw me on the table and just give me an adjustment? Is we need to be able to see the spine, and the best way to give you an analogy is you don't work on the car or the engine unless we lift the hood up and we can see what's happening underneath. So in your spine, we want to do the same thing. We want to make sure that we're not guessing, that we know exactly what's going on with you. And I can tell you that countless times we've taken x-rays of people that nobody prior to had taken an x-ray, and people could not believe, right? There's things that we could not do that was better not to do, and that other people had done, and that was not appropriate for them specifically. And at our office, we want to make sure that we're not taking any chances, that we're going to be taking care of you the best that we can. And part of that is we want to be taking pictures of your spine or x-rays of your spine just to check, double check, triple check. And then on top of that, if you are engaging into a spinal correction program, we will be able to compare apple and apple to see if your spine is changing, progressing, or if there's any new things that shows up over time. And then also there's many cases where people have scoliosis, they don't even know unless you take an x-rays of their spine. So it's also important, in kids, that you might be thinking that if they do have scoliosis that you want to be taking x-rays. That's totally appropriate for them to have that, and make sure that you monitor them properly, and if they need to be referred out, that you can do that appropriately. So this was the question of the day with Dr. Jean-Guy. I hope you guys have a great week.